Histology of uterus. The histology of uterus, the histological layers, the pattern is same as that of other region of the female reproductive system, that is MMS. As we are seeing here, both gender, male and female, they are indulged in the multimedia messaging system, that is MMS. So mucosa, then comes muscle layer and serosa. In uterus, mucosa, also known as endometrium, it is made up of epithelium plus lamina propria. Here is this one is epithelium, and after that this one is lamina propria, a big area. Epithelium is of simple columnar type, and lamina propria divide into stratum basal and stratum functional. Functional again divided into stratum compactum in the luminal aspect and stratum spongiosum, having a spongy texture for giving a space to the artery and gland. Then come this one is myometrium. Myometrium, the muscle layer, that is luckily longitudinal, then circular, and then again longitudinal. Outer longitudinal, middle circular, and inner longitudinal. But middle circular, this one is not purely circular. Actually, it is circular plus longitudinal, haphazardly pattern. It is arranged in haphazardly pattern and known as reticular. Also known as stratum vasculaire due to the presence of blood vessel within the middle reticular layer. Okay, there is large blood vessels, and it is also known as stratum vasculature because this type of pattern, this reticular pattern, it constricts the blood vessel, acts as ligature after delivery, postpartum, and after menses, that is postmenstrual. And as we all know, MMS, so mucosa, muscle layer, and then comes serosa, which is also known as, in case of uterus, it is perimetrium, which is nothing but the visceral peritoneum with adjacent connective tissue having blood vessel, a small blood vessel, lymph, the lymphatics, nerve, and elastic fiber. Now, mucosa differ with stages, that both epithelium and lamina propria, they are different in proliferative and secretory phase. We all know that ladies are natural inventors and like James Watt. But here the spelling of James is, as we all know, the ladies are very reluctant to this James. So the spelling will be James Watt, Gems. G for gland, E for epithelium, M for mitotic figure, S stroma, James Watt, that is WBC, artery and thickness, endometrial thickness. Gland, these all things will be more in secretory phase. There are two phases of the menstrual cycle, that is the proliferative and the secretory phase. In secretory phase, all these will be more. Okay, and in proliferative phase, all will be less except this mitotic figure. Only this much, this one will be more in proliferative, mitotic figure. Now gland, again divided, these are subheadings of gland. The gland has got subheading, again gland, that is glycogen store, L for lumen, A for architecture, N for number, and D for discharge. That in secretory phase, the gland will be more. Both will be more. In gland there is glycogen store will be more. The wide lumen, the architecture in the secretory phase, it is step ladder pattern, tortuous. And in the proliferative phase, it is simple tubular. But in the secretory phase, it is tortuous step ladder pattern, and the number will be more in the secretory. Everything will be more in secretory except mitotic figure. And discharge, as its name itself says, secretory phase, so more secretion, more discharge. And now second one is the epithelium. In proliferative it is simple columnar, and in secretory it is hypertrophied columnar. Mitotic figure will be more in proliferative. Mitotic figure is what? The cell, showing the cell division, and due to which the chromatin will be completely filled, densely packed within the nucleus, and there will be no space in between the nuclear membrane and the chromatin. That type of cell is known as mitotic figure. As this is in proliferative phase, so cells, the mitotic figure will be more compared to secretory phase. And again, rest of these are more in the secretory phase. That stroma, amount of stroma will be more in secretory, WBC will be more, artery, the number, and the tortuosity, both will be more in the secretory phase. Endometrial thickness, it is 2 to 3 mm in proliferative and 4 to 5 mm in secretory phase. Here, this is of secretory phase, the histological slide. That's why they are very tortuous. So many glands numbers are more. And in this slide you can see there will be very less amount of artery and gland within the lamina propria. Okay. So this is of proliferative phase and this is of secretory phase.